Hello, Ellie.
Hi.
I'm Jara, be your personal trainer. So, what we need to do first is we're going to create a session plan for you based on your goals. Okay? So, in this, if we find that there's any kind of problems you have with dietary problems, nutrition problems, you're going to have to go and see somebody else. Same thing if we have any injuries, but we'll find that out later. There's no one in the gym, so we don't have to be worried about anybody in the gym. And everything that we go through here is going to be confidential because I've got client confidentiality over you, so you don't have to worry about anything that we do in here. It will all be confidential. No one else sees it except for me. Okay, the first thing we're going to do is the adult pre-screening questionnaire. So the point of this is just to figure out if you've had any kind of ailments or anything that I need to know about before I start creating a session plan for you. Mm-hmm. Okay, so has your doctor ever told you that you have a heart condition or have suffered from a stroke?
No.
No? Do you ever experience unexplained pains in your chest at rest or during physical activity?
No.
No? Do you ever feel faint or have spells of dizziness during physical activity or exercise that causes you to lose balance?
No.
Have you had an asthma attack requiring immediate medical attention?
No.
If you have diabetes type 1 and 2?
No.
Do you have any diagnosed muscle, bone, or joint problems?
No.
Do you have any medical conditions that may make it dangerous for you to participate?
No.
Awesome, very good. Okay. Can you just sign that at the bottom, please? To make sure that's all true. Today is 26th January. Awesome. So I'll go through this with you. So this is just the second bit of it. There's a little bit more detail. So how old are you?
23.
That's 23. Do you have a family history of heart disease?
No.
No. Okay, so none of that. Do you smoke cigarettes?
No.
Not the last 6 months?
No.
Awesome. Okay. Describe your current physical activity levels.
I would say moderate.
Okay, so moderate. Mm-hmm. Yeah, and how many sessions per week would that be?
3 to 4.
3 to 4?
Mm-hmm.
3 to 4. And how long would each session be?
45 minutes.
45 minutes?
Mm-hmm.
Awesome. Okay, do you know how tall you are? I mentioned you before.
Yeah, we did. I was 158.
Yeah.
Yeah. You could do it at 0.5.
Okay, 158.5. Mm-hmm. And what is your weight?
About 70 kilos.
70 kilograms. We'll get on scale and do that later. Okay, have you been told that you have high blood pressure?
No.
No. Have you been told that you have high cholesterol?
No.
And have you been told that you have high blood sugar?
No.
Awesome. Okay, so based on all of that, you've scored 0 for everything. Your BMI is 24.8, so 30 would be over. Mm-hmm. So you're 0 with that, and because you do more than 150 minutes a week, you're at -1. So your overall risk factor is actually -1. Quite good. Yay. Okay. Have you ever spent time in the hospital, including day admission, for any medical condition in the last 12 months? No.
No. No, I haven't.
Are you currently taking a prescribed medication?
Yes, just the pill.
Okay. Have you been pregnant in the last 12 months?
No.
Do you have any muscle, bone, or joint pain or soreness that may be worse by doing this kind of activity?
No.
No. Awesome. Good stuff. Okay, so we've got the stage 3 here. We're not going to be measuring your fasting lipid profile. We're going to get your resting blood pressure in a second, and we've already calculated your BMI. So your risk stratification is less than 2. So you are a low-risk client. Individuals at low risk may participate in aerobic physical activity, exercise up to a vigorous and high intensity. Mm-hmm. So that's what we're going to be aiming for today. Mm-hmm. So you are -1 for that. So this is just a lifestyle questionnaire. So what we're going to do here, and this is obviously confidential as well. So what we're going to do here is go and try and figure out, give me an idea of what we're going to do for your plan. Okay, so we've got some goal setting here, your activity levels here, and just some of your interests, your likes and dislikes. Okay, so could you go and fill in the top for me? I'm done editing now. Okay. Yeah, emergency contact.
Yeah.
Awesome. And your occupation. So I just need to know what you do for a living, so we can kind of figure out what exercises or what stresses you might be under. So you're a teacher. Good. Okay. So on a scale of 1 to 10, please rate how active you are on a daily basis. So that includes anything after school as well.
Yeah.
Yeah. Good. So how many hours of sleep do you get a night?
1 to 8.
Good. So are you currently involved in any exercise program?
Yes. So if I do like a boot camp, I try boot camp.
Yeah. So boot camp's fine if you do that extra.
So boot camp for 45 minutes every workout intensity. I would say like medium to high.
Yeah.
Okay.
Awesome. Okay, so now we're going to go over your goals. So obviously you're here for a reason. We've got our short goals, our medium goals, and our long goals. So we're going to be using the SMART acronym, which is specific, measurable, attainable, realistic, and timely. So in the short future, so within the next couple of weeks, what would you want out of this program?
I guess in like a couple of weeks, even just to, I guess like maybe feel like more comfortable in the gym and like know how to use equipment, things like that.
Okay, so
More confident in like how to do exercises in the gym.
more knowledge of the exercises and equipment. Awesome. And medium-term goals, so between, let's say, 2 to 3 months.
Yep. I'd like to see, I guess like a good one for me would be like to, I guess, be able to run like 5K without stopping.
Okay, so 5-kilometer run. Okay. Any time limit, or just without stopping?
Just without stopping. Yeah. Without having to walk for some of it. Yeah.
Without stopping. Or walking. Good. And in the long term, so let's 6 months to a year.
Could it be even something like fitting like a certain size of clothing again or something like that?
I want it to be
Like a bit more like specific.
a bit more specific, so let's
like,
talk about weight.
an amount lost. Like amount of weight lost.
Could be amount of weight loss. It could be amount of centimeters off a specific area.
All right. I would say I'd probably want to get to like 65 kilos within 6 to 12 months.
Okay,
So like lose like 5 kilos and go weight 65.
Lose 5 kilograms to 5 kilos.
Go weight. Yeah.
Okay, and then whereabouts are you in relation to the goals? Obviously, you go to the gym already.
Yeah. I'm probably able to like meet that short-term goal pretty easily. I think even like the medium term, like I think that's like pretty realistic.
Yep. So we're on our way.
Yeah, I definitely think
Yeah.
in the making.
So we're making progress already.
Yeah.
Good. And so what's the biggest challenge to overcome? So in order for you to get here, what are you gonna struggle with the most?
Probably my eating, like my food is probably more the issue than the exercise.
So nutrition
Yeah,
over exercise.
and just like not just like what I eat, but like when I eat as well.
Yeah.
Like making time.
And on a scale of 1 to 10, how committed are you? 10 obviously being the most committed.
Probably a 9.
9,
Yeah.
can you get it done? Good. So these are just your training preferences. So just to figure out when is the best time for you to start. Some people like the morning, some people like the afternoon, how long you usually like to go, and also what kinds of exercises you do.
Okay. So I think obviously like I'm not working today, but if it's a work day, like I always prefer the afternoons. I just feel too rushed in the mornings. I like to train 3 to 4 times a week, and I would prefer to do 30 to 45 minutes.
And then the types of exercises, do you enjoy something that's a little bit more practical, or do you like the dumbbell or the weight stuff, or do you like body weight exercises?
I think I definitely prefer like body weight over like lifting actual weights a lot.
Yep.
And I think I would prefer to like do like, almost like superset things, so I don't have to do them.
Yeah.
Like, don't have to spend as
high
long.
intensity training.
Yeah, so like I prefer to train for less time, but have like a bit more sweat. So if I write HIIT,
Yep.
high intensity interval training, Yeah.
And do you follow or have you recently followed any specific dietary plan?
No,
No. Okay.
not really.
So no specific plan. Very good. Okay, so what I want you to do here is just the amount of servings that you do, roughly how many times you eat these things.
Okay.
Okay?
So milk, yogurt, or cheese.
So you pick a random day. You want to pick tomorrow or yesterday?
Yesterday, yeah. So like yesterday, I would have had like 2 portions of dairy, like like coffee and then like a yogurt, vegetables, probably 2 as well.
Yep.
Portion of fruit, 1, meat, poultry, fish, eggs. We've had 2 because I had lunch and dinner. Grains, cereals. I probably would have had 2 of those as well. Glasses of water. Well, I drank 2.5 liters yesterday.
2.5 liters.
Yeah, so a glass is like half a liter. It's like half.
Yeah, so say 6 glasses.
6. I drank yesterday. Alcohol yesterday, 0. Coffee and tea, I had a coffee and 2 teas, so 3. I had no Coke or soda. I had 1 caramel slice. It doesn't have nothing, but I did yesterday. That was pretty much it.